Thank you for joining us. Thank you for investing your time, your energy. Thank you for seeking answers, because the reality is that there is a tsunami of pain out there. And it's not getting any smaller, it's getting bigger. And it's rising up, and we're just starting to feel it now. Our suicide rates continue to climb. Every day in the news there's someone famous. Australia has one of the highest rates of suicide in the world. The highest cause of death in 14 to 44-year-olds is suicide. And that's not including all the single car accidents, as we saw with that dear footballer who took his life just very recently. So we have to do something different. What we're doing is not working. The government is hemorrhaging. And what's happening is that more and more practitioners are realizing that the clients in front of them, the patients in front of them, their issue is actually a trauma-related issue. They may be presenting with extreme panic attacks and anxiety, but what's behind that? It's trauma, otherwise known as distressing events. So let's just take away the word trauma, because when people think trauma, they think war, refugees, torture. So let's just say distressing events. And that gives us a much broader view and a much more real view. So a client comes presenting with anxiety or depression or with chronic fatigue, fibromyalgia, etc. And then they might say, well, I don't have any trauma. But yes, they do. One of the first questions is, when did it begin? And then we look at what was happening around that time, but we'll get into that more as we go along. So this webinar is trauma therapy training. Resolve trauma-related issues in 3 to 4 sessions, and it's generally 3, can I just say. And it sounds too good to be true, doesn't it? Well, it's not. We have about 200 practitioners around Australia now, and we're bringing the research together to prove the process. So stay tuned. We'll be releasing some of that very soon. All right. Now, in order to understand about trauma and how to resolve trauma in 3 to 4 sessions, and I'm not going to go through the whole process today, but just give you an overview. The first thing that we've got to understand is how the mind works. Let's just look at the mind. I'm going to do a very, very complex infographic. If we say this is the mind, and we think that the conscious mind, that voice in our head, is where it's all happening, but it's not. And we educate our clients on this. This is exactly how we speak to our clients. Let's look at the conscious mind. The conscious mind is being shown now. We use that about 10% of the day. It's only small. There's the conscious mind, and the rest is the unconscious. Yes, there are shadows. Sorry about the shadows, but it just shows that I'm not a hologram, I'm a real person. That's the conscious mind, and the unconscious runs everything. So let's have a look at what the unconscious actually does. Even before we're born, we take on ideas of who we are, whether we're safe, whether we're loved, whether we're wanted. And then we're born. And for some people, that's a life-threatening experience in itself. And then we grow up. Up until about the age of 7, 8, our brainwave state is theta. It's a slow brainwave state. We live in the imagination, in daydreaming. We do not have the critical facility that kicks in as we get older. So what does that mean? That means that we're a little sponge. We're just learning, lapping up everything. One of the main things that we're taking on is ideas about, are we safe, who we are, how the world works, our place in the world. And so we take on ideas that form our foundation, these core fundamental beliefs that are locked down in the unconscious. There's a reason why the Catholic Church and the Nazis say, give me a child till they're 7 and they're mine for life, because that's when our foundation goes down. And that foundation can support us or not. So we can take on ideas such as, I don't matter. We can take on ideas from somebody in authority, an adult in authority who says something to us. We think, well, they must know. So, for example, the year one teacher who says, you'll never amount to anything. You'll never get a job. And we go, oh, well, they must know. It goes straight in because there's no critical facility to filter out things that are not true. They just go in. So we take on ideas from people in authority, like a parent who says you should never have been born. You're a burden. Or our tiny person's perception of what's going on. So our parents break up, and the tiny person whose world is completely egocentric, they're the center of their world. That tiny person takes on the idea, well, it must be my fault. If only I was better behaved, Mum wouldn't have left or Dad wouldn't have left. It's my fault. And what happens is that person, that little person thinks, well, then everything must be my fault. So it takes on this idea, everything is my fault. Everything in the world is my fault because their world is just the family. So if there's something wrong in my world, it must be my fault. This is a little sensitive person here. And they grow up and the world becomes bigger and bigger and bigger. And they might be in their 50s and still running from that idea, everything is my fault. So they may find themselves as a compulsive rescuer because if everything is my fault, then surely it's my responsibility to fix things. So these unconscious core beliefs that we take on, things like I don't matter, and I'm going to swear here, brace yourselves, but it's a very common one. I'm shit and I deserve to be treated like shit. I deserve to suffer. I deserve to be punished because I'm a very bad person. These ideas run our life. And so somebody with those ideas that they've taken on when they're little, of course, they'll have a pattern throughout their life, which will be very difficult for them. Guess what the pattern will be? Anybody? What would their pattern be if they've got those unconscious core beliefs? Oh, I deserve to suffer. I deserve to be punished. I'm shit. I deserve to be treated like shit. I don't matter. I'm worthless. Yes, thank you, Heidi. Low self-esteem. Yes, but they'll have a pattern not treating themselves well. That's true. They'll have a pattern. I'm no good. Thank you, Sharon. I'm not important. Yes. I don't matter. Everything's my fault. Nothing I do matters. That's true. Hurting others, possibly, but they'll be bullied. They'll be abused. They'll have a big sign on their head. They will subconsciously pass on the traits to their family. Yes. Amanda. Hey, Amanda. So they'll have a sign on their head, abuse me, bully me. And they'll go through school. They'll be bullied. They'll go to work. They'll be bullied. They'll go into abusive relationships. Or they will be bullies. Yes. In some cases, they'll be bullies, Jan. You're quite right. So what we have to do is change these unconscious core beliefs, because just let's talk about a normal client who comes to you for therapy, whether it's physical therapy or psychology. Heidi, hurt people hurt people. Yep, that's right. So this person has come and their conscious mind, whether they're there for a physical ailment or whether if you're a doctor, if they've come to you as a psychologist, as a mental health professional, their conscious mind is saying, I want to get well. That's why I'm here. But what can happen is the unconscious can be saying it's not safe to be well. Because if you're well, you'll be out in the world and the world is not safe. Having been through experiences that laid down that idea the world is not safe. So the conscious mind here is saying, I want to get well. But the unconscious is going, you're dreaming. It's not going to happen, because the unconscious's job is to keep us safe. So there will be unconscious sabotage. So if you're trying to work with a client to assist them to a place of wellness and their unconscious is not on board, you're going to be pushing the proverbial uphill, but you will really get somewhere if you've got the conscious and the unconscious in sync. Now you're cooking. Now there is real power in that. So if you're a relationship counselor, is anybody here a relationship counselor? If you type in. Because if you're a relationship counselor and you're working with two people who consciously want to create a warm, safe, intimate relationship, and the unconscious, which is the big guy, is saying, because of ideas they took on when they're little, anyone who's supposed to love me is going to hurt me. Anyone who's supposed to love me will betray me. Anyone who's supposed to love me will abandon me. Well, the conscious mind here is going, yeah, I want to create this fabulous relationship that's safe and warm. But the unconscious is going, no, it's not going to happen. I will get you out of this. And there'll be unconscious sabotage because the unconscious is running on the idea, anyone who's supposed to love me is going to hurt me. So the unconscious will be trying its best to get that person out of the relationship as quickly as possible, and there will be unconscious sabotage. So, yeah, and absolutely, Helen, I have to be alone to be safe. Things like that. And so if we get the conscious and the conscious mind in sync, yes, it's safe for me to love and be loved. And it's safe for me to trust my own wisdom as to who I can let in close. Then you're cooking with gas if you're a relationship professional. This is the first thing that we must do as healers, whether we're body therapists or GPs or mental health professionals. We have to get the unconscious and the conscious in sync, in agreement about being well, in agreement about being safe in relationship, in agreement about being safe with success, in agreement about being safe having money, for example. But we'll go into that a little more. So we have to get the conscious and the unconscious in sync. No matter, and if you do that, if you just do that, your results will go right up. And it'll be much easier for you and much easier for your client to achieve much more positive results. That's what we do in the first session of TRTP. Let's just look a little at the physiology of trauma. And some people have seen this graph and some haven't. So I'm going to do it anyway. This is the graph. When you have a normal person lives here at calm. They go along, they have a stressful event, they release stress hormones, adrenaline, etc. The event passes, they don't have to think about it a lot, they don't have to meditate for 5 days to recalibrate their system to bring it back to calm. It just happens automatically. Isn't it fabulous how we do that? They go along, they have a life-threatening event, they come up here to fight, flight, freeze. The event passes, they don't have to spend a long time willing their body to go back to calm. It just happens. We self-regulate. And that is key, this self-regulation. But what happens, however? What happens when that switch to self-regulate gets turned off? And why does it happen? Well, the outcome is that someone stays up here. They never come down from here. They've had an event that's brought them up here and they stay up here, or even worse, up here in extreme PTSD. And it's a spectrum, isn't it? You know, anxiety peaking with panic attacks, or just general garden variety anxiety. It's terrible that we call it garden variety anxiety. It's just because it's so epidemic. But it's a spectrum. All of this is a spectrum. It's the anxiety spectrum. And what's behind it is the whole being is screaming, I'm not safe. Why? If you've had anxiety, or if you are still suffering from anxiety, you'll know that feeling. I'm not safe. My body can't relax. Something bad's going to happen. That's what's behind anxiety. It's also what's behind shutdown depression. It's just that for anxiety, we go into fight flight. We go into that hyper-aroused state of, and in depression, we go down into freeze. But behind anxiety, behind depression, is I'm not safe. Anxiety and depression are simply symptoms of trauma. And let's take away that word trauma again and say distressing events. I'll say that again because it's really, really important. Anxiety and depression are simply symptoms of trauma, otherwise known as distressing events. And what happens is we have a distressing event. We release, the amygdala goes off, the emergency services, and adrenaline is released, and other stress hormones, stress chemicals are released in the body. And if enough of them are released, what happens is, of course, the instinctive part of the brain, the ancient part of the brain, reptilian part of the brain, lights up, and the frontal lobe shuts down because you don't need to do higher maths when you're running away from a Tyrannosaurus Rex. With that shutdown of the brain, the hippocampus also shuts down. The hippocampus that is responsible, it's the librarian of the brain. It takes a short-term memory and makes it long-term. And what happens, okay, so you have the distressing event, you've got the emergency services go off, you release adrenaline, other stress hormones, the being gets overwhelmed, the hippocampus switches off with other parts of the brain, and it stays switched off. What happens is it doesn't take that event once it's over. It doesn't take that event and store it in memory and shut the door in the warehouse of memory, and that's over. What happens instead is it gets stored as a videotape loop in the unconscious, as if it's happening now, it's happening now, it's happening now. It never gets brought to an end. And so we end up with all these videotape loops in the unconscious. When I was 3 and that happened, and when I was 7 and that happened, and when I was 10 and that happened, when I was 16 and that happened, and et cetera, et cetera, et cetera. And what happens is the distress builds up and builds up of all these videotape loops, like the pressure in a balloon. And then it gets to a point, and it can be the straw that breaks the camel's back or a catastrophic event, doesn't matter. We blow out. Some people will blow out into anxiety, some into depression. Some, if it's a big catastrophic event, will go into PTSD. Some will go into chronic fatigue, fibromyalgia, lupus. Some people will go into irritable bowel syndrome or other disease states. You put enough pressure on something and something has to give. Something's going to blow. So what happens is when you've got all these videotape loops going in the unconscious, and the unconscious runs every chemical reaction, every electrical response in the body, runs the whole thing. And so the body is behaving as if those events are happening now, which leaves us in a state of I'm not safe. These videotape loops only break through into the conscious mind because we're not consciously aware of it. We just know that we're so strung or so shut down. It only breaks through into the conscious mind in states of extreme PTSD. It breaks through from the unconscious to the conscious in the form of flashbacks. So we have to take this person who's in this I'm not safe, the other hyper-aroused state of anxiety or the shutdown state, the frozen state of depression. We have to take them from this place, I'm not safe, to down to here. It's over and I'm safe now. So that we have this self-regulation kicks in again, so that we can still have distressing events because life happens, but we go back into self-regulation. We don't get stuck up here in these or down in depression. So the people who are coming and sitting in front of you, if you're a therapist, who are presenting with anxiety, OCD, hoarding, depression, and obviously PTSD. Those things are simply a symptom. The anxiety is a symptom. The depression is a symptom. The OCD is a symptom. What's it a symptom of? It's a symptom of the whole being screaming, I'm not safe. Why? Because I've got these videotape loops going in my unconscious of things that have happened, distressing events that have happened that have never been stored properly in memory, and it's over. They're happening now. That's happening now. That's happening now, which leaves my body either hyper-aroused or shut down or oscillating between. So just about everybody sitting in front of you, if you're a therapist, what they're presenting with is a symptom. It's not the issue. The issue is trauma. There's a strong correlation between chronic fatigue, fibromyalgia, and lupus and trauma. You'll find if you have a client with chronic fatigue and you say, well, when did it start? When did the symptoms start? And then you go back and look at what happened around that time, just before that time, you'll find that there was the balloon just got too big, too much distress, and it blew out into chronic fatigue or into fibromyalgia. And this is how we work. So, two things have to happen to get from I'm not safe to it's over and I'm safe now. Two things. If you look at the work of Bessel van der Kolk, Peter Levine, they agree that two things have to happen to get someone from that stuck space of I'm not safe to it's over. And those two things are the person has to be moved to an empowered position in regard to what happened. Because at the moment, whatever happened has the power and they don't. So we reverse that, so they take control. And the other thing that we have to do is Levine and van der Kolk say we have to tell the body it's over. Because they say trauma is stored in the body. I say trauma is stored in the unconscious. And the unconscious runs every chemical reaction, every electrical response in the body. So of course we experience it in our body. But I say we have to not just say it's over, but we have to say it's over. The person has to know it's over and I'm safe now. Now there's a difference. If you say this out loud with me and just observe what happens in your body, in your being. Say with me, you ready? We're going to say it's over and just see what happens. It's over. Try it again. Just observe what happens. Feel what happens in your body. It's over. Good. Now say, it's over and I'm safe now. And just feel what happens. It's over and I'm safe now. Do it with me again. It's over and I'm safe now. It's resolution, isn't it? It's over. We're still up there, but it's over and I'm safe now. It feels good. For some people, just saying that a number of times brings down their anxiety. Doesn't turn it off, but it brings it down. So, how do we turn off these videotape loops? And there'll be lots of them. Lots of little ones, lots of big ones. And what we find is that it's like a four-legged table. If we turn off these big videotape loops of dreadfulness that's happened, that leaves us stuck in that state of I'm not safe. If we turn off these big ones, the little ones automatically turn off. It's like taking a four-legged table and taking one leg out and the whole table falls over. So we don't have to go searching back through the person's history to find every distressing event. No, we just look at the top 3 most distressing events. We turn those videos off, returning the person from the hyper state or the shutdown state of anxiety and depression where it's I'm not safe to it's over and I'm safe now, because their body's no longer responding as if it's happening now. It's quite simple, really. So how do we do that? Well, as I said, TRTP is a 3-session process. In the first session, we change the unconscious beliefs to the positive. Those things such as, I don't matter, become, you know what? I do matter. You know, I deserve to be treated with care and with respect. It's safe for me to love and be loved. And I can trust my wisdom about that. It's safe for me to stand out. It's safe for me to be seen and heard. I don't have to be invisible in order to be safe. We change the unconscious core beliefs from the negative to the positive. We get the unconscious and the conscious in sync, in agreement. And then there'll be no self-sabotage. And the pattern of the client's life will change. The pattern of bullying, the pattern of illness, the pattern, whatever their pattern is, abuse, it will change because it's run by those unconscious core beliefs. Change the unconscious core beliefs, it changes the pattern. We don't experience the same things. What we do with TRTP is we give the client homework. Just a simple template for them to list their top 10 to 12 most distressing events. Just the age they were, the name of the event and who was there. Nothing else. No big essays. A lot of clients who are self-aware have massive ahas at this point because they can see it's the same thing again and again. It's a pattern. So we get this snapshot by taking the top 10 to 12 most distressing events. We get a snapshot of the client's pattern. The client's pattern is run by these unconscious core beliefs. I don't matter. I'm shit. I deserve to be treated like shit. It's not safe for me to love or be loved. Those who are supposed to love me will hurt me, etc., etc. It's not safe to have success. It's not safe to stand out. It's not safe to be seen or heard. We change these in session 1. And what happens then is our experience of self changes. Our identity shifts because our identity is based on these beliefs we took on when we were little. And we create this delusion of who we are and we live that. And someone might meet us and say, oh, wow, you are this, this, and this. And we go, well, no, I'm not. But we're the one living the delusion, not them. So what happens in that first session is we change the unconscious core beliefs to the positive and we introduce the client to who they are, the truth of who they are without those negative unconscious core beliefs. Take note, they're unconscious. They're not in the conscious mind. Consciously, we might think I matter, etc., etc. I had a client a little while ago, an incredibly successful, wealthy man. And we started to do some work to change the unconscious core beliefs. And I said, say after me, blah, 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 whatever it was, I don't matter. And I'm shit and I deserve to be treated like shit. And he said, that is so untrue. Have you seen my bank balance? You know, I matter. I'm not shit. I'm a great guy. Just ask anybody. Just ask my banker. But as he started to say it, whoa, as we were changing those unconscious core beliefs, he became a snot crier. He was so shocked where all that emotion came from. So it's unconscious. Remember the drawing with the conscious mind is just a little bit, 10%. The unconscious runs everything. So it's not a consciously held belief, it's an unconscious belief. And we have ways of finding what they are. So in the first session, we changed unconscious core beliefs to the positive and introduced the client to who they really are. For a lot of people, that is transformative. And it leaves them in an empowered state to go forward into the second session, which is where the rubber hits the road and it puts their unconscious and their conscious mind in sync, so there will be no sabotage going forward. So we can do the work and it's safe for them to get well. So every part of them's on board. The next thing that we do in session 2, and this is the big session. This is the one where the rubber hits the road, as I've said. We turn off those videotape loops. We turn them off. We take the emotional charge. We remove the emotional charge from the past. How do we know that we've actually done that? How do we know we've turned off the videotape loop? We know because there's no emotional charge. We say to a client who's been through even the most horrendous trauma, you'll know you're done because you'll be able to talk about what happened to you and it will just be, just be boring. The story will be boring. And some people in tears say, oh, I'd love that to happen, but really, I can't, I'm sorry. I can't even imagine that. So, well, you don't have to because I know exactly what the outcome is going to be. All you need to do is follow my instructions. Throw yourself into this and you can expect a miraculous outcome. And then in the third session, we create the future. Because people who are stuck in anxiety, stuck in depression or whatever it is, they don't really have a future focus. So we have to create that. So how do we turn off these videotape loops? We have a specific way of changing unconscious core beliefs. And in session 1, we use, in all of this, we use a fabulous facility that we all have. You know how I was saying these tape loops are stored in the unconscious. So doesn't it make sense to speak to the unconscious in the language of the unconscious? What's the language of the unconscious? The language of the unconscious is the imagination. So all these videotape loops, all those circles, they're stored in the unconscious, not in the conscious mind. If they were stored in the conscious mind, we would have figured out years ago what to do with them. We just have to take charge of our conscious mind and it'll be fine. It was 10 years ago, the Black Saturday bushfires were 10 years ago. It's over and I'm safe. That would be great, but it doesn't work, does it? And that's why CBT takes longer. If it works at all, it takes a long time. It's a big effort and it's a conscious discipline. But with this, it isn't. It's just automatic. Why? It's because we deal with the trauma where the trauma is stored. These videotape loops are stored in the unconscious. So doesn't it make sense that we deal with it where it's stored? The language of the unconscious, we speak to the unconscious in the language of the unconscious, which is the imagination. I'm sure the word magic comes from the word imagination. So we create various scenarios to move the person to an empowered position in regard to what happened, and then tell the body and the unconscious it's over. I'm safe now. And every part of you that has anything to do with that time can now return to calm. Feel it. And we watch as sometimes the Parkinson's-like tremor of extreme PTSD just disappears, as often someone loses years from their body, from their face. Because it's like that 4-year-old is stuck in Groundhog Day back here in that event, and that 20-year-old is back in Groundhog Day, stuck in Groundhog Day, living the same thing again and again every day. We turn all that off and the whole being returns from I'm not safe to it's over and I'm safe now. The hippocampus whacks into gear, puts the memory away, closes the door. No more emotional charge. It's like doing a factory reboot on your phone, if you've ever done that. Returning your phone to how it was when you first bought it. That's what we do, but we do it on the brain. using that extraordinary facility, the imagination. How does that work? Well, the imagination, we experience it in dreams, don't we? And anything is possible in your imagination. You can have flying dreams. You can have all sorts of stuff happen in your imagination in dreams. So what do? We simply use that, because the body and the unconscious doesn't know the difference between what's real and what's imagined. And I'll say that again, it's important. The body and the unconscious doesn't know the difference between what's real and what's imagined. Let's just do a little exercise. I'll show you a little example of this. So put your hands together, and most people, not everyone, but most people will have one middle finger. So we're just looking at the middle finger, that one. Most people will have one finger a smidge longer than the other. You can see this one's longer on my hand. So have a look at your own. Do this exercise with me. Your long-fingered hand, the long one, put it on your lap. The short one, hang it down by the side of your chair. And we're just going to do an imagination exercise. Throw yourself into this. Just imagine. So you've got your hand down by your side. I'm going to bring mine up here so you can see. You can have your eyes closed or open. It doesn't matter. Just imagine there's a weight attached to your middle finger. Putting it in traction feels quite good, really. And just imagine that that weight is actually causing your middle finger to become longer and longer. Stretch out your finger as if that's happening, and get a sense of that. That weight is pulling your finger. It's in traction, and you get such a sense that that finger is just getting longer and longer. Feels a bit odd. Now just imagine there's a second weight. Ooh, now you're feeling it up into your forearm. Wow, feel that. It's not hurting. You can certainly feel the traction, feel that pull of those two magnets, and just imagine that that finger is getting longer and longer and longer. And now imagine there's a third magnet. Uh-oh. It's not hurting, but it wouldn't want much more to make it hurt. You've got those three magnets pulling it down and down and down, and just imagine that finger's just getting longer and longer. Get a sense of it. Feel it as that finger just gets longer and longer and even longer. Feel that. Wow. And now bring your hands up and have a look. You can see that my short finger is now longer than what my long finger was. My body has responded as if what I imagined is absolutely real. With this facility, people are able to imagine away tumors, disease states. A few years ago, I was diagnosed with hydrocephalus, and what that is the spinal fluid goes up the spine and bathes the brain and goes back. It circulates. But what happens with hydrocephalus is that the fluid goes into the brain, but it doesn't come out. When babies suffer from this, their heads just get bigger and bigger. But in adults, our brain plates our head plates are fused, so there's nowhere for it to go. So what happens is we have seizures and then we die. So I was having seizures, and they wanted to put me in hospital straight away to start draining the fluid, and I did a quick research stint and thought, no, it often ends in early dementia and early death. I don't mind the death. I've died 3 times. It's quite pleasant. But the dementia, I didn't want to go there. So I said, no, give me a week and I'll fix it. Let's have another MRI in a week. And they said, you might be dead in a week. I said, well, that's all right. So every day, what did I do? I was really busy. So I imagined every morning, I got my scans and I imagined all that fluid draining away back into the spinal cord. I did that for about 10 minutes. Then I'd say to the body and the unconscious, I have to go to work because people are relying on me. But you can keep doing this all day. And at night, I'd say the unconscious, body and I are going to sleep, but you don't sleep, so keep doing this. All night. We've got 5 days, 4 days, 3 days, 2 days, 1 day. I went back with the MRI to the neurosurgeon, and he immediately rang up the place I'd had the scan done and said, there's been a mix-up. My patient has hydrocephalus and this one doesn't, so please sort that out. And I got up and went to leave and said, where are you going? I said, well, I'm obviously well, so see you later. He said, no, you're booked in for surgery in the morning. You're not going home. I said, yes, I am. So the imagination, there's been so much research showing that the brain is plastic, but I'll go further than that and say the body is plastic as well. We have so much more power than we ever imagined. So, how did you go with the fingers? Helen Ducal saying, wow, yeah. Yes, it works. In the same way, you can imagine sinking your teeth into a wedge of lemon, and I've got the saliva response. My mouth is going nuts. It's behaving exactly as if I really did have a piece of lemon. So we use the imagination, which is the language of the unconscious. The unconscious and the body believe what we richly imagine. We step a client through various scenarios which they richly imagine. They live it. They feel it. They experience it. And the body and the unconscious goes, oh, so that's how it is now. Okay. Then we tell the unconscious and the body that it's over and you're safe now. And every part of you that has anything to do with that time can now return to calm. Feel it as they come from that fight, flight, freeze back to calm, and their whole system is recalibrated. It's like doing a factory reboot on the phone, and they return to being self-regulating after a stressful event. And the symptoms simply disappear. What happens with most therapy is it's cognitive based, and what happens is we go from thinking, feeling, to being. The thought being, or the theory being, if we change how we think, which takes discipline, that will change how we feel, which will change how we behave. And that's fine, but it takes so much energy. What TRTP does is it's AAT, Ask About Therapy. We start with this. That's number one. We take the client to a state of being, which naturally changes how they feel, which naturally changes their thinking. They don't have to use discipline to change their thinking. I had a client who drove about an hour and a half to see me, and her self-talk was so dreadful. She would tear strips off herself all the time. And after our first session, where we changed unconscious core beliefs, she drove home, and when she got home, she called me. So I just had to call you, because all the way home, I was trying to think the old thoughts, trying to say terrible things to myself. And I'd get halfway through the thought and I'd forget what it was. I just couldn't remember what it was I'd started thinking about. She said, this shit works. Wow, I don't even have to try. I'm trying to think the old way and I just can't. So that's how TRTP works. It's 3 sessions, sometimes 4. And it takes the client from I'm not safe to it's over and I'm safe now. It turns off those videotape loops, which takes the emotional charge out of the past. And the symptoms, the anxiety, the depression, the PTSD, the fibromyalgia, chronic fatigue, whatever the symptoms are, the symptoms simply disappear. The PTSD, even the most extreme PTSD, the rage of the PTSD, the nightmares, the hypervigilance, it all just switches off and the entire being returns to calm. That's what we do. And I warn you, if you do this training, it's addictive. Why is it addictive? It's addictive because we see change. We see change. Sometimes we see the most miraculous change. We call them Jesus moments. There was a young woman in her mid-20s who had, I forget the name of it. It's when you have paralysis, pseudo-paralysis, psychogenic paralysis, something disorder. Anyway, and she had been dreadfully sexually abused by her mother's boyfriends as a young person, and she had reverted to being a baby. Conversion disorder, that's right. And she could not walk. She was in a wheelchair, and she only spoke baby talk, and her mother and another family member had to look after her 24/7. That woman is now a vibrantly healthy, running around, mid-20s woman traveling around Australia as we speak. Why? Because her body had lost the power to walk and had reverted her to babyhood because it wasn't safe. She was stuck. I'm not safe. Her whole being screaming that. So what did we do? Changed the unconscious core beliefs, turned off the videotape loops, told her body and her unconscious, it's over and you're safe now. Spoke to the unconscious directly and said, you've been keeping her safe, out of the world, stuck as a baby, unable to walk. Good job. You're fabulous. You're so powerful. You run every chemical reaction, every electrical response in the body. Go you. But now her need has changed. Now she knows she's safe. We've turned off all those videos. Her whole being has returned from I'm not safe to it's over and I'm safe now. So now her need has changed. She needs to be out in the world, fully engaged, having fun, like a young woman should be having fun. So starting now, do whatever is required in every neural pathway, every cell, every atom in her body, every aspect of who she is right through her soul, to as quickly and safely as possible, return her to complete good health, vibrant vitality. Do it now just because you can. Thank you. And that's the outcome. We see so many miraculous things. But for low-grade anxiety, depression, it's just as effective because it's all run by the same thing. So let's now talk about, because a lot of people here are wondering about the training. If you go to therichards-traumaprocess.com, take a cut lunch for this one. I know it's long. therichards-traumaprocess.com, and go to the training page, and you can also click on a button. On every page, there's a button where you can make a 20-minute. You can make an appointment to have a 20-minute conversation to explore TRTP further and see if it's a match for you. Obviously, we'll be exploring if you're a match for us too, but let's have a conversation to answer any particular questions that you have. And the questions here, I'll be coming back to them. The program is an 8-week program. It begins with you doing your own work. So yes, you get stepped through session 1 and session 2 of TRTP, because they're the main sessions. You do that one-on-one with your mentor. Everyone is assigned a mentor. This is one of the big things that we do. We absolutely support you through those 8 weeks of training. You have your own mentor. Your mentor will do the work with you, either online or face-to-face. TRTP is equally as effective online as it is face-to-face, which means you're no longer geographically constrained. When I'm doing clients, which I'm not at the moment, but when I am, 95% of my clients are online, and most of them are overseas. So because what happens is you work with some bloke here in Australia, and his brother's in New York, and his sister's in London. And so it goes, because they want what he's having. After that, and you're sent some training materials, after that, there's a 3-day workshop. This is the only face-to-face component. And it's very experiential. Then you start working with your own clients, with your mentor holding your hand. At the end of the 8 weeks, you don't just have information and knowledge, you have experience, you have runs on the board, you've been working with your own clients, you know exactly what you're doing. But then it's not over. Then you go into the TRTP practitioner community, which is warm and kind and generous, with egos left at the door, and there is so much support there in an online forum where you can put a tricky case and get so much assistance. And we have a 1-hour video conference call each week as well. So it's continual professional development, and in capital cities we meet and support each other. So that's the training. But it's the outcomes that matter. It's the outcomes that matter. And the outcomes are so often nothing short of miraculous. As I said, we call them Jesus moments. Why? Because we deal with the distressing events, otherwise known as trauma, where it's stored. We turn off those videotape loops. We get the unconscious and conscious mind in sync. We change the unconscious core beliefs, which changes a person's experience of who they are. That's why we insist that everyone who comes into the training does their own work, so that you understand the power and the possibilities of it, so you know what the experience of your future clients is going to be. Also, so that you're clean and clear coming into the training. It's profound, profound work. It's extraordinary work. And it shifts not just the client, but the dynamics of all their relationships. It saves lives. It changes families. It takes away the hurt, and hurt people hurt people. I used to specialize in violent, angry men brought against their will. You know, the guys, you see it in the papers, see it on the news. The fellows who have been under house arrest by their family members because they're hell-bent on going and killing their ex and the new boyfriend and the children. And they would come in against their will, and they'd swear and carry on, you're granny. And in an hour and a half to 2 hours, they would be safe, and everyone in their world would be safe. Why? They weren't compliant. They were not compliant. They wanted to go and do what they wanted to do. But in 2 hours, sometimes an hour and a half, they would be safe, and everybody in their world would be safe. Why? We simply turned off their pain. It's not flippin' rocket science. Followed some of those men for 7 years now, and they've never, ever had that rage ever again. And their life continues to get better and better. So just to answer some questions here. Jane, you've got your hand up. I'm sorry. If you've got something to ask, could you type it in? Because I won't be able to talk to you. But if you can type it in, let me just go back. Jacqueline, you can do all the work, and in one moment the client pulls straight back into fear. TRTP connects people on an internal level, the gift of shifting the unconscious core beliefs and connecting it. Yeah, it just works. It just simply works. And where did it come from? It comes from my own journey through extreme trauma. So I was the youngest of 8 in a violently incestuous Catholic family. My brothers, I had 3 violently incestuous brothers. We were Catholic. Did I mention we were Catholic? And we used to have members of the church staying, priests in the highest levels. One priest was the head of the Maris priests in Australia, Father Peter Gurin. You can look him up and look at his track record. And yes, he interfered with me as well. I could tell you so many stories about priests. At 15, I was drugged and sexually assaulted by a Catholic nun. Then I worked my way up through stalkers. By the time I was a teenager, I'd introduced myself. Here's my unconscious core belief. And I was saying it out loud consciously. Hi, I'm Jude. I attract violent lunatics. What can I say? It's a gift. And I worked my way up through stalkers, up through violent relationships, until I found myself with hierarchy in the Nutters Brigade, a homicidal psychopath who was into torture. So over 9 years, I was cut up, basically, tortured. His cutting was his thing. At the end of that 9 years, the surgeons put my body back together as best they could, told me I'd be in chronic ill health and chronic pain for the rest of my very short life. And that was in 99. I died 3 times during all of that, and I'm still here. I then lost my mind. And that was a gift, because during that time I put TRTP back together again. What do I mean when I lost my mind? I was split personality. I was living in hallucinations. I was the mad bag lady in Mullaney in Queensland. I'd walk up and down the streets talking 1,000 miles an hour, saying the same thing again and again, you know, with the beanie pulled down and oversized dirty men's tracksuit pants on. Yeah, I was absolutely insane. And what happened was the people in that town saw me get well, and they started bringing others to me, and that's how it started. So this works. It's based on experience. It's not based on theory. From R, I've just been through this with complex PTSD. It's stunning. Reverse engineered key parts helping others already. Go you R. Can't wait to learn the rest. Well, we'd love to have you. Complex PTSD is no more difficult than normal PTSD or garden variety anxiety or depression. Makes no difference. It's the same thing. Turn off the videotape loops. Tell the person, the body and the unconscious, it's over and I'm safe now. And every part of you can now return to calm, and those videotape loops just get turned off. The hippocampus puts the events into memory and we are free. And there's no emotional charge in the past. It's just boring. You emailed your question. Okay, Anne, great. I'll get back to you on that. Just realise, really pleased you keep the process so simple. Yeah, it's a simple process, Jane. It's not rocket science. It's really simple. It's simple to learn. It's simple to use. It's simple for the client. I had a client the other day. Yes, I do take the odd client, but not really. And she said, I can't believe that it was so easy. She was laughing during the second session. She said, it's so easy. Really keen to do this course to help myself and pass it on. Yes, pass it on. Pass it on. In my own family, we've had 3 suicides. I mean, people are turning up at A&E, like my cousin last year. He was very suicidal. He went to emergency, begged them to help him. They told him there was nothing wrong with them and they didn't have a bed. So, you know, off you go. And so he went and jumped off a very high bridge on the Brisbane River and was fished out the next day by early morning rowers. It's horrendous, the pain out there. You know, I was in Bunnings the other day and this young mum, I knew she was going to go off. She was exhausted. You could see she had a couple of little kids and I stayed sort of close to her in the same lane, you know. And something happened and she went off. It was inevitable. And everyone walked away going, oh, dear, 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 that dreadful young mother. How terrible. That poor mum. I went up to her and said, are you okay? And she said, no. I just hugged her and gave her my card, said, come and see me. You're not a bad mum. You just got too much pressure. I'm a big sook. I get so concerned. We got to do something. Come and join us. We're going to change how mental health is done on the planet. We have within our practitioner community, we have academics, people like, no, anyway, I won't go into their names, but they are taking the research and running with it. Our small end point is to change how mental health is done on the planet, just because we can, because it's very simple. It's very simple. We're taking it overseas next year. We're being invited to different countries. Come and join us. This planet is at a tipping point. People's lives are at a tipping point. Families are at a tipping point. There is too much pain. There does not have to be pain. There does not have to be pain. Come and join us. I'll get back to you. Sorry, I've gone a little bit over time. If you've asked a question, I will get back to you by email or give you a call or something, but I will answer your questions. Thank you. So, go us, hey? The world needs us. Thanks for being here. Hope we'll hear from you. If you want to have a conversation, go to the website, therichards.traumaprocess.com. Click on Q&A, 20-minute, make an appointment, and we will call you at that time and have a conversation. See if this is a match for you. See if we're a match for you. Let's see if we're a match, and let's change the world just because we can. Thank you. Have a great evening. Bye.